So we're on chapter 7, bones and muscles. And the key concepts we're going to be talking about is the design of the skeleton and the structure of bones, bone growth and development, and joints. And this one in joints. And then the next video we'll talk about muscle tissue and skeletal muscles and how muscles need to be exercised. So let us begin on chapter 7. So here we're talking about the skeleton. You see right there, the skeletal muscles, and of course we have this picture of a guy lifting weights, which makes our bones and muscles stronger. So let's get going. Here we go. Okay, let me just focus on the skeleton right here. So the skeletal system, we're going to talk about the skeletal system. The skeletal system is our framework. And how many bones do we have? Do you know? 206 bones in our body. And the bones, of course, are very unique because you can imagine they're self-repairing. They're almost as hard as concrete, but they're far more resilient than concrete. And they're precisely engineered. And also they're powered by muscles. And they have cable-like tendons that attach them to each other. Tendons, tendons attach muscles to the skeleton attach the muscles. Ligaments attach bones to bones. Just remember that. So tendons are muscles attached to skeleton bones. And then, of course, ligaments, skeleton to skeleton. Also, bones, they reproduce red blood cells? 2 million blood cells per second. That's a lot of red blood cells. And then, of course, white blood cells too. And white blood cells are agents of the immune system. And they also are produced by bones. And also in bones, they store minerals, especially calcium and phosphorus. And if we didn't have these minerals, then we wouldn't be able to live. They're important minerals in life. So let's talk about the skeletal system. The skeletal system, there's 2 parts of it, and one part is called the axial, and the other part is called the appendicular. Axial, just think of the axis, the center axis. And appendicular, you think of appendages, because we have appendages. And what are our appendages? Of course, our appendages are our arms and legs, right? Those are appendages. So we have the axial and the appendicular, 2 different parts of our skeletal system. So let's talk about the axial here. So here's a picture there of a skeleton with the axial. So can you see this here? Let's see if it's labeled. Okay, there we go. So we have in the axial skeleton 80 bones, and this includes the head and the spine. There, as you see in that picture. And it also includes such bones as the hyoid bone that turns our head. It's a U-shaped bone there. And of course, onto the sternum, right here is the sternum, and the ribs here. They're parts of the axial skeleton. And on to the vertebrae. And all the way down to the sacrum and the coccyx. All this area that's in the yellow is the axial skeleton, you see there. So we have the cranium, facial bones, ear bones, hyoid bones, the sternum, ribs, the vertebral column, which is 26 bones in all, and the thoracic cage of 25 bones, and down into the sacrum and the coccyx. Okay, so let's go on. We'll go on to the appendicular, a little bit more into the skull. Let's talk about the cranium. The cranium is the skull that we're looking at here. So let's look a little bit in depth at the skull here. So you'll notice here, there's 2 really parts of the skull. So we have this part and this part. What this part is called, basically, the top part of our head has 8 bones, and it's called the cranium. And then we have the facial. So we have the facial and the cranium, right? So going on to that, the cranium. Let's just talk about the cranium here. So when we look at the cranium, what do we see? We see, we have, first of all, the frontal bone. You see that's your forehead, called frontal bone. And then on to the parietal bones. And there's two halves of the parietal bones, is like the top of your head there, the parietal bones. And then you have the temporal bones. And they're by your ears, like on your temporal areas. I always call the sides where your ears are, right? The temporal bones, the sides. And then, of course, we have this at the bottom, the occipital. And the occipital, of course, is the back of your head. It's kind of weird if you hit your head, it affects your eyes because your sight is in the back of your head. How amazing is that? So let's go on well, before we do this, your book tells a little bit about infants and how infants' heads are different than adults. How would you say? Well, the infant's head have fontanelles, and these are fibrous connective tissues or soft spots. So have you ever, let's go up here so we can see here. I guess it just tells about it. But fontanelles are soft spots in the infant's head, and of course they all grow together as they grow. This gives the head easier growth, and so they'll gradually the fontanelles or soft spots will shrink away, and they turn into sutures. These are called sutures. These are the divisions of the skull. So it's kind of weird, isn't it? You know, that they grow together and they have these sutures, and they're kind of uneven lines or shock absorbers. So basically, why do you think an infant would have a soft spot or a fontanelle? Probably to get through the birth canal. How hard would be its head to get through, so its head can actually be more flexible with soft spots, right? And also these sutures there in the head could be shock absorbers. So basically, you're less likely to get a fracture if you have shock absorbers in these suture areas. So let's go on to the facial bones. Okay, we're gonna look at the facial bones here. Can you see? Facial bones, you have two maxillary bones. These are the important ones you really need to know. Maxillary bones, and that's right above your teeth. This whole area here is the maxillary bone. And they are attached underneath, and you don't see it here. There's a palate, and your palate is the top behind the roof of, I should say, the roof of your mouth is your palate, and that's underneath there, and that's the palate bone. That's not even pictured on the outside of here. And then you have a mandible. This is very important that you know about the mandible, because the mandible is the lower jaw, and it's the only movable part of our skull. It's the only movable part of our face is the mandible, moving up and down so that we can talk and chew and all these things. And then of course we have in between here, we have ligaments here that are between the mandible and onto the skull that hook on, that attach there. Ligaments are basically connective tissues between bones, right? And also we have in the head, we have sinuses. Well, what's a sinus? When you have a sinus headache or your sinuses, you have problems in your sinuses because of allergies. These are hollow places that are in your skull. And you have sinuses behind your maxillary, around your nose area, around your temporal area, and all these in different facials. You have these hollow places where sound waves can resonate in speech, and it also can makes the skull a lot lighter. So sinuses are those hollow places. And of course here we have these other bones listed that are smaller bones of the face. The ethmoid bone here, this little here, nasal bone. Lacrimal is where you have your tears. Lacrimal mean your tear glands. And sphenoid bone here, so you have these other bones. But ones you really need to know for sure and remember the name are maxillary and mandible, because it's the upper of the teeth, and then of course your jaw, So let's go on here, and we'll go on to the next page. Let's see. Let's go here first. Hopefully this is, I forgot to go down here. Your picture here in the lower right pair shows beneath your mandible here you have a special bone, and this bone is called the hyoid bone. The hyoid bone is U-shaped. Just remember it's U-shaped. So it's U-shaped, so it goes right in your neck so you can turn your head back and forth. This hyoid bone is very important, and it's not part of the skull really. It's really part of the neck. And also it attaches your tongue muscles to it. So you have to, in speaking and everything, using your tongue, you have to use your hyoid bone, okay? And it's also ability to swallow. If without this bone, you couldn't even swallow. And if you couldn't swallow, you couldn't live, could you? So that's important. And then there's three bones. And basically these bones, smallest bones, are gonna be in what? The temporal area of your ear. Actually, they're inside your ear. I don't have a picture of ear here. So, but the ear has the smallest bones. They're in the middle ear. There's 3 little bones. And later on, we're going to study the ear. So the 3 little bones are the malleus, like a mallet, which means hammer. Incus. Incus means anvil. And stapes means stirrup. So a hammer, anvil, and stirrup. You know, and these are tiny bones inside your ear. So the tiniest bones of all your bones are in your ear. Remember that. Malleus, hammer, incus, anvil, and stapes, the stirrups inside your bone. And your temporal bone there has a hollow cavity, and they have an eardrum in this hollow cavity, which takes in the vibrations, you know, so that you can hear sound of vibrations. So going on to the bones of the spine now. So we're gonna talk about the spinal cord right here. So you have what's called the vertebral column. That's this column here, and it's your backbone. And it has 33 vertebrae, right? 33 of them. So, and all of the other parts of the vertebrae, of course, some of them are attached to the front as the ribs and stuff. So we go on, but these 33 bones have intervertebral discs. So here's a picture of vertebrae, and inside each one of these little discs, you see how these discs separate them. Inter means between. So intervertebral discs are between them. And these discs are very flexible cartilage, so you can move your back, you know, so you can move around with your back because they're flexible. So with cartilage usually is flexible. And they allow the spine to twist and bend. And they're also shock absorbers. So they absorb shock if you would fall. So if you'd fall, you wouldn't break your back so much because you have these discs. Sometimes the discs get out of line, and that's when sometimes you have to have surgery. Older people have to have surgery on their discs and their cartilage disc. And cartilage is basically, what is cartilage? It's that tough, rubbery connective tissue. That's what it is. So, and then we have where we have these hollow, this is the vertebrae. You can see how it has a hollow area where the spinal cord goes right down, the spinal nerve goes right down. This long vertebrae column is the spinal cord, and where we'll find the nerve, and it's very protected, as you can see by the bones. Here's where it would go through, right here, this hole, where the nerve spinal cord would go through. So there's 5 sections of the vertebrae. So let's go up to the top one. We have the first are the cervical, and there's 5 cervical. Actually, there's actually 7, 5 cervical bones, and then 1, 2, 3, 4, 5, 6, 7. But these 2, this is the atlas and the axis. These 2 help our head turn. So this is attached to our head there, and these 2 are very important part of the cervical, the atlas and the axis there. So our head can swivel back round and forth, you know. Not backwards though. But anyway, so we have these other 5, and then these other 5 cervical vertebrae coming down here. The cervical vertebrae are smaller, as you can see, as the thoracic. The next section, thorax means chest, right? So in the thorax, we have 12 vertebrae, and they're thicker and larger, of course, than the cervical. and that's where our ribs will attach in these thoracic vertebrae, okay? So going down, and let's go down further. See if I can get down here, there we go. So now we're getting down to the lower, which are the lumbar vertebrae. And the lumbar vertebrae are thicker than the thoracic even. And that because they bear our heavy burdens. You know, when we sit down and stand up, and if we fall, yeah, all these things affect our lumbar vertebrae. So, and there is how many of these? 5. So we have 5, 1, 2, 3, 4, 5 lumbar vertebrae. And then we go down to the last, and as an adult, you have a sacrum and a coccyx. And this is your tailbone. And it's called the sacral or pelvic vertebrae, these vertebrae. Now, a child has more vertebrae here, but as you grow, these vertebrae turn into just those 2. The sacral or the sacrum they usually 5 of them, 5 bones in the infant, and they fuse into one sacrum, and they join into the hips there. And then the coccyx, there's tiny 4 bones in an infant, but now here we have this in an adult. And these 2 are like shock absorbers. The coccyx is a very good shock absorber, you know, because of how many times have you fallen, you know, fallen on your rump there. And of course, you know, you can break your coccyx pretty easily, but most of the time it's a shock absorber. It helps us to stand upright and helps us eliminate wastes. Now you can look at the curvature. See how it's curved there? There's different curvatures in it that are normal the curvature of see how this cervix curvature, the cervix curvature, the thoracic curvature, how it curves, and down into the lumbar curvature, and all the way down to the pelvic. You see how each one of them, there's actually 4 curvatures, and each one as they curve. And that's normal for our spine to curve in this way. If it's curved too much, then of course we have other problems, don't we? So let's go on here. Here's a picture though. Here's a picture of the atlas here. The atlas and the axis. As you see the attachment bones with the attached for the skull there. See how they attach for the skull? And then you have the atlas and the axis, and the bearing surface is there, and you can see how they go together, those top of the cervical bones. So let's go on to the bones of the chest here. So see if we could get going with the bones of the chest. So here we have pictures of the bones of the chest. We're gonna get done with this here. So the chest bones. And so they protect our vital organs, as you see those bones of the chest do. And the thoracic cage, thorax means chest, and they attach to the vertebrae from the back. I see how they are attached there. And the sternum in the front. So they attach to the sternum in the front, and then to the backbone as the ribs come around there. And you can see them in your own body, huh? And the cartilage attached to the sternums. They have cartilage in between here. A lot of this area is cartilage where they attach. And why is it cartilage? Because when you breathe, basically the bones need to move a bit when you breathe, so your lungs can contract when you inhale and exhale, right? When you're breathing. So we have 7 pairs of true ribs, and then we have 3 pairs of false ribs, which do not connect to the sternum. That makes them false. They don't attach to the sternum. And then we have some floating ribs at the bottom, 2 pairs of floating ribs. So the true ribs attached to the sternum, and then we have the 3 pairs of false ribs, and then 2 pairs at the bottom. So we have false ribs, that means they don't attach to the sternum, and then we have the true ribs, 3 pairs of them. So that's in a normal body, okay? So let's see, we're gonna stop there with the axis. We're gonna go on to the, basically onto the appendicular with the appendages.